SI joint stability, that's sacroiliac joint stability, and what to do about it, how to stabilize it, is the subject of this video, so stay tuned. Hey, this is Dr. Shaki from Irvine Spine and Wellness Center, your chiropractic, posture, and movement clinic. Sacroiliac joint instability, that's the joint right here. People call it hip joint. That is not your hip joint, that's your pelvis joints. And instability there is so common. There are so many things we do wrong that actually feed this problem. For instance, crossing the leg is not a good idea when you're sitting on your chair and let's say you're looking at a monitor here and a laptop over here and you're doing this twisting, or you attend meetings and you're sitting here but the speaker is there and you're doing the twisting. Long-term rotation or compression is a very reasonable way to start this problem, though that is not the only way the problem starts. Obviously you can play sports and go to the gym and work out the wrong way, and you don't even know you're working out the wrong way. It's just that you're really loading the joint unfairly, and that causes the instability in the ligaments that keep the two bones together. And when you have ligamentous instability, the whole area is compromised. So let's talk about ligamentous instability, what that even means. When two bones come together, what keeps them together is ligaments. So that's kind of like a box, like an Amazon box, that you want to reinforce the edges of the box because you want to make sure that it's stable. So ligaments are that tape that keeps the wall and the floor of the box, as an example, together better. A reinforcement of it. So when you have conditions or situations that will most likely want to separate those two surfaces, those ligaments are the reason why they don't separate. Of course, within reason. If you really load it up, it can separate. So a lot of the instability comes as a result of core structures that are designed, are existing to stabilize, but they've been loaded too much. Everything has a tolerance to load, and when you go overboard, you can do damage. So what are some of the exercises you need to do? In my opinion, the first step is to do the breathing correctly. And you're thinking, what does breathing have to do with a SI joint? Breathing is the only way you can actually get to the front of the sacroiliac joint anyway, because you've got your skin, there's that space with your internal organs there, and the only way you can actually push against that SI joint from the front is through inner abdominal pressure. So proper breathing is important. So if you breathe correctly, and that's biologically, not something that you learn in a yoga class, as an example. Not that I'm putting the yoga down, it's just that biological breathing is that basic breathing that most people don't have. We're gonna make sure that we put a link or that video at the end of this video that you're watching so you understand how to do the breathing. Make sure you also follow us, you subscribe to the channel here, and you follow us on Instagram and social media, or Facebook, it doesn't matter, we are there too, so that way you can understand these things in a more regular basis. All that information, by the way, is in the description box. So breathing is the first thing that has to happen. My next go-to place is teaching my patients what plumb line is, what the straight line is. That's when your ear, the point in the middle of your shoulder, your hip, and the outside of your angle, all on the side view, is all nice and straight. And then you practice to stand on one leg with the plumb line intact. So standing on one leg means you're shifting your weight from one foot to the other, not swaying, but simply shifting. And then you bring the opposite leg up in a bent position. So you're standing on one leg. Of course, make sure that you're not gonna fall, so have a chair or something in front of you. And then you are holding on to that, just not holding on, but it's there to just in case you're gonna fall. And you practice balancing. If you can hold for long, it's okay. You switch over to the other side, and over time you will balance better. But those things are the basic steps that need to happen. If you go and isolate your sacroiliac joint and try to do exercises for your sacroiliac joint, it is not going to last long. Finally, I want to bring to your attention the importance of not just focusing on just the SI joint. So the things that are connected to your pelvis, like your lower extremities, your spine, the way your posture is, if you're collapsed or not, will directly impact your sacroiliac joint. So it is a holistic approach to a localized problem. I know we all wish there was a simpler way, but it is not. When your sacroiliac joint is compromised, that means you've been doing a great job damaging something that's so crucial. That is the core of, or the foundation to your trunk. And when you mess that up, a lot of things will be impacted. And everything above and what's connected to your pelvis will impact your sacroiliac joint too. With a chronic SI joint problem, you will have pelvic floor dysfunction. I had to throw that in because people don't realize. And if you're thinking pelvic floor dysfunction means you can't hold your pee, you're mistaken, because that's only one version of its presentation. And also if you're thinking, oh, I'm not a woman who got pregnant and has gone through pregnancy and given birth, so I'm cool, you're mistaken. So make sure you follow us on social media, you subscribe to the channel, you can subscribe to my newsletter so you receive the emails, so that way you can educate. At the end of the day, your guesses need to be a much better educated guesses, and that only happens with educating yourself about your own body. Hope this helped. Take care.